Hi, this is Dr. Stu Currie with Mojo Feet, here to chat with you about how to dispense an orthotic, talk to a patient about break-in protocol, and then what to do if something needs adjusting, or needs tuning or tweaking with the orthotic. So the first thing we want to chat about is how to discuss with a patient what an orthotic should feel like when you first put it on. Number one, your Mojo Feet Custom Orthotics come with a little card that talks about adding 1 hour of wear per day, increasing an hour as each day goes by until you're about 7 or 8 days, and then you're wearing it 7 or 8 hours or pretty much a full-time day. So we want to start our patients off with, today you're going to wear it 1 hour. You're going to take it out of your shoe, right? So tomorrow you're going to wear it 2 hours. Take it out of your shoe. The next day, 3 hours, working your way up to about 7 or 8 hours. So the reason we do this is so that the patient can adapt to the orthotic. We've got both a physical force adaptation as well as a nervous system we have to train to a new position. The analogy that I use with patients is kind of like the braces analogy, right? So when you get braces as a kid on your teeth, sometimes you have to get them tightened, and when you do, sometimes it can be achy, right? You can feel things differently. Your bite might be different, that kind of thing. Same thing applies to an orthotic here, right? We are making a change. Sometimes the body protests change a little bit, and we want to do that slowly over time. So talking to a patient about that helps set their expectations for what they might feel. When a patient comes into your office and you dispense the orthotic, you remove the insole from their current shoe, replace it with the Mojo Custom, and you have them maybe walk around the room or walk down a hallway if you have one. You almost want to set your patient's expectations as far as what they are going to feel. So I like to tell the patient, this is going to feel strange, different. You might feel like there's something, pushing up against your arch. You're going to feel this differently, and this is important. You're going to feel this differently from your left to your right. This is one of the things that a custom orthotic does, right, is correct differentially, both in shape, which comes from the cast, and then the flexibility that it allows, which comes from your clinical evaluation, the Mojo Matrix scanner, if you're using that. And those are important variables that we use to tune the orthotic, right? And so this should feel different. It should feel a little odd. And I described the break-in protocol and what it should feel to a patient before I let them walk out of the office. Of course, if I tell the patient, if it's sharp and stabby, call me, let me know, right? This is also something you can take out of your shoe. So if it feels too uncomfortable, you can't get through 2 hours, let's say, don't go up to 3 hours until the 2 hours feels good, right? So that's your patient expectations for what they should feel. The bottom line is when you lay all that out, maybe some patients aren't going to listen to you, right? And they're going to go out and wear them. And you know what? You can't blame them because it might be solving their problem. Their feet might feel better. Their plantar fasciitis might be better, whatever it is the reason you got them the orthotics clinically, right? And so they're going to be like, these feel great, right? I'm going to wear them. And so a lot of patients will come back and say, yeah, you know what? That was pretty crazy for the first couple of days. It felt like, I was kind of walking on the outsides of my feet, that type of thing. Felt like a big bump in my arch. But you know what? After a couple of days, it was great. I started wearing them. Things are going well. That'll be the vast majority of your patient's experience. However, I feel that setting the expectations for the fact that this is a process, when we look at studies in a lab of changes that happen, let's say in plantar pressures with orthotics over time, sometimes we can still see changes being happening at 4, 6, 8 weeks, right? So intervening before that becomes a little bit problematic because you're not sure how much of the foot is still adjusting to this new corrective position. So you always want to give it at least a few weeks with a patient before you start to consider making a change. So let's talk about that. What happens when you do want to make a change to an orthotic, right? So there's a couple main things that happen when you want to change an orthotic. This may be because, look, it's uncomfortable enough that the patient cannot get through the break-in. They've given it their good try, and it's just not working, right? Changes down the road also come when maybe the patient has plateaued in their symptoms. Maybe their situation is that the orthotic really helped for a period of time, and now the symptoms are starting to creep back, right? Those are kind of clinical scenarios where we might want to say, okay, is there something about the orthotic that needs to be changed? I'll tell you, and I don't mind sharing this, that Mojo Feet runs at about a 4 or 5% warranty rate. So somewhere between 1 out of every 20 and 1 out of every 25 orthotics may need to come back for some sort of alteration. I'm okay with that. There are some labs out there that want to get that number way down. I get that, but the only way to really do that is to start lowering arches and not being as aggressive as you could be with your casting, not going full correction. And that's what we're about, right? So I'm okay with a certain amount of warranty, setting your patient's expectations, and also communicating to them that, all right, look, hey, there is no money back guarantee on this orthotic, right? This is a custom device. It's a treatment, it's care. That's something that we're agreeing to and coming to an agreement that we're going to move forward with this. Most patients kind of understand that this is not a television set that can be, placed back on a shelf and resold. So they get that. But the other thing you're going to tell them is that I work with a great lab here that is going to work with me. So for 6 months, if something needs to be tweaked or changed, that's part of what you are purchasing when you purchase a custom orthotic, right? You're buying, part of what you're paying for is the ability to further customize this should your situation, something happen where you don't quite fit the tuning bell curves that we use, right? Maybe you fall outside the normal distribution of a patient for your body weight and your foot flexibility and your activity levels and the other things that we tune an orthotic to. No problem. This is why I work with this lab, and this is what we're going to do. So while there is no money back guarantee per se, I work with a lab that's going to do with me. We're committing to get this right for you. From our end, as a side note, from Mojo Feet's end, within the first 6 months, we are going to do whatever it takes to get this right. So, we pay for shipping. You can send us, we ask that you send us a warranty form with a description of what the problem is. You can also draw on the orthotic if you have a marker, if there's an particular area that's bothering a patient, if there's a lingering complaint, whatever it is. The more you communicate with us, the better job we can do taking that orthotic and saying, okay, we're going to look at the cast, we're going to look at the information the doc is giving us, and we'll ask you some follow-up questions. The more information you can give us and provide us about the pain, quality, location of that problem, the better off we can do, right, for you guys. So we ask that you send that in to us. And then we're going to typically make one of two changes, right? There's two main variables we can tweak. Number one is the shape. And the shape comes from the cast. So especially if you're using the Mojo Matrix pin scanner that sends these to us digitally, you are welcome to recast the patient. Maybe something happened the day of the casting. Maybe you were busy. Maybe the patient was in an extra amount of pain and you weren't able to get something about the foot corrected correctly. There's a few different possibilities that happen, right? You can send us a new cast. We just ask that in the notes section, please write, warranty recast, and then say that the orthotics are on the way, right? And you'll be sending us back the patient's pair of orthotics. When we get that information, we can take it all, look at the old cast, look at the new cast, see if there's anything we see that might explain the problem, and go from there, right? The other big thing that we change is the flexibility. So flexibility can affect how much the patient pronates. and perhaps, again, maybe for their body weight and their situation and their foot flexibility, they might just fall outside of the normal distribution here, and we might need to make a tweak, whether that is make it more flexible or remake the orthotic and make it stiffer for more correction. We can do that on our end. All covered, all taken care of in the first 6 months of wear. So that's basically the gist of describing to a patient what an orthotic should feel like, our warranty policy and how to handle that should something come up, and setting patient expectations about all of this. This is how we try to do a really good job for our patients and our providers at getting the best custom experience for each and every individual. I hope that all makes sense. Thank you for listening.